Olivia.
Thank you very much. So unfortunately, I'm not a researcher, but as a malaria advocate, we take any opportunity we have to pass our important message. So thank you very much, MMV, for having us. And I just want to talk to you about what we are doing right now on the ground in the fight against malaria. So I live in Cameroon, and I had malaria several times. But unfortunately, and fortunately, I was always able to get quality treatment. But I know a lot of people who are affected by the disease, and I know what this disease can do. So for this reason, it's important that we accelerate the fight against malaria. We saw the progress that were made during 2000 and 2015, leading to the reduction of 50% of child mortality for malaria, which is thanks to the work of everyone here and others. But we also know that there are high risks that we are facing today. We know that there are issues with resistance, we know that there are issues with fake drugs, and also there are issues with access still, because we do have a lot of communities and a lot of people who still don't have access to quality malaria services. So for this reason, we believe that it's very important to involve community actors as not only as service providers, but mainly as actors and decision makers, and people who can actually be involved from the implementation phase to the monitoring and evaluation phase, but also support the national malaria control programs and partners to make critical decisions. So community health workers who are on the ground, who are actually the frontline workers, and who are able to reach the patients who needs malaria services critically, needs to be more involved. So for this reason, we have joined forces to create the first global network of civil society organizations, local African NGOs, community actors who are advocating for malaria programs that are people-centered, that are gender-sensitive, that are human rights-based, that are fully funded, and most importantly, that are sustainable. So we are looking forward to continue to advocate to our own leader to increase resources for malaria, and also to all of the partners to involve these actors to make sure that they can contribute to the data collection project through community-based monitoring project, because we believe that there are a lot of people out there that needs to be reached, and we have a lot of data that can be shared from those community health workers. And just an example, in Cameroon, for example, community health workers were able to report 70% of simple malaria cases. So if we didn't have them on the field, we will miss 70% of malaria cases. And they are not even yet in all the districts where they need to be. So my message was just to get all of us to continue to support community system strengthening and also community health workers, because they are doing an amazing job, and we think that is what is needed to accelerate the fight.